All right, everyone, it's about time to get started. Thank you so much for joining tonight's webinar, special healer webinar about CBD and CBDA in particular. And my goal for tonight is to answer our most common questions that we've been receiving and to answer all of your personal messages or questions. If you have those as well, we'll do our best to get to them at the end. This session is being recorded, so if there's anyone on right now that doesn't want their image to be a part of that recording, just please turn off your camera. But for the rest of you, I'm very happy to have your image here. It just feels so much more real to be able to see you all and to make this, to some extent, a two-way conversation. It's just lovely that way. So I am going to pull up some slides and we're going to go through some topics, but I'll just tell you about what we plan to cover tonight so you know to stay in. We're going to talk about how CBD works and go over a little bit of the evidence for some of the most common conditions like anxiety and pain. We'll talk a little bit about CBD and opioid dependence as well. We'll talk about topical CBD, how some people can use CBD for sleep and what impact that might have on sleep. We'll talk about combining CBD and CBDA with THC. We'll talk about the spectrum, the broad spectrum, the isolate, all those questions about what type of CBD product. Little mention of liver toxicity and addressing some concerns about that. And then we'll get into the products, some of the problems with products out there right now, and what to look for when reading a certificate of analysis and how to evaluate a good product. So hopefully that'll take care of most of the common questions, and then we'll dig deeper into whatever's left out. So I am going to share some slides. Okay, are we ready to go with slides, audio, video?
Yeah, looks great.
Perfect, thank you. Okay, so just a little introduction for those of you that don't know me. I'm an osteopathic physician. I'm a general practitioner, and I've been working with cannabis in the clinic for about 11 years here in Maine. And I do a lot of educating as well of all different walks of life, including patient education. We have a lot of content on healer.com that's free. I do industry and industry professional training through our Healer Certified Training Program. And then I'm frequently in a position to educate clinicians of all sorts all over the world, which is something I love doing. And I'm also on the board of directors of the Society of Cannabis Clinicians and do my best to help lead this emerging field of medicine that really focuses on cannabis and the endocannabinoid system. I am the co-founder and equity owner of Healer, which is a company that's done all those things that I mentioned, but we are also now in the product business. We have hemp-based CBD and CBDA products and medical cannabis products just in 2 states, Maryland and Maine. And so I guess what I'm saying by that is there's a potential conflict of interest that, you know, maybe I'm trying to say things about CBD in order to sell products, but that's really not where I'm coming from. I've been practicing without my own products for a decade. And while there's good products out there, and I've certainly seen patients have excellent responses to some of the products that are available both locally here in Maine, but also nationally, it's still not a perfect marketplace, so to speak. There's a lot of products that are mislabeled and contaminated. We're going to get into those problems. But I've just had so much frustration working with patients and doing my best to help patients get great results and being limited by the quality of the starting materials that are going into the products, the final products, the process that's being used to make the products, which sometimes can decrease the value of the active constituents and decrease the overall quality. So I've been kind of dreaming for years about what my formulary might look like. If I could have a shelf full of any products at all to treat my patients with, what would that look like? And what would I exactly want in there? And what would I want to use for starting materials and so forth? And I'm just so excited that right now this year, this is really happening for me to have my dream formulary come true. And so I don't think this is a conflict of interest. This is, in my opinion, a confluence of interest, because what I really want is to get great results with my patients and to have my students and my followers be able to get great results with their own treatment, whether it's supervised or unsupervised. And so that's really where I'm coming from here. I want to make safe, highly effective products for people to get great results with. So let's just start off. What is this CBD craze? It is everywhere, and a lot of people don't know what it can do and how to use it effectively. There's lots of questions in the headlines, full spectrum versus broad spectrum. This was just from a few days ago. The CBD business is booming, but little is known about the actual benefits, as reported by ESPN. Lots of athletes are using it. So as always, education is the key to success. And this is what I hope to convey to you all tonight. So to begin with, what is CBD? Well, if you look at it from a molecular structure standpoint, as you can see in the slide here, CBD looks so similar to THC. It's almost exactly the same. The only difference occurs here. So just one molecular bond different, and you have a different molecule with really distinct pharmacologic effects, which is one of the things that nature does. It often creates molecules in a variety of formats with slight variations, so that you can often, when using an herbal medicine, have a number of these so-called phytoconstituents that can work synergistically together. And that's exactly what we see in the cannabis plant. Is hemp oil the same as CBD oil? The answer is no. Hemp oil is wonderful stuff, but usually that term is referring to hemp seed oil, which would be the oil you get from pressing hemp seeds. It's a very healthy food oil. It has omega-3 and omega-6 fatty acids in it, and hemp seeds in general are a very healthy food. But I think one of the problems that I've been running into a lot with patients who kind of try something that they think is a CBD product and then come to me and say it doesn't work, is that a lot of these products really don't have CBD in them, or they might not, might just have very little of CBD in it. So this product is just one example, and I blanked out the brand name, but if you look on major retailers like Amazon, for example, there are lots of products that are kind of looking like they might be hemp or CBD products, but really they're just hemp seed oil. And so again, it's great for nutrition, but not great for medicine. So you have to be careful about that. How does CBD work? A lot of different ways. And so I'm just kind of summarizing the biggest effects in the body. To begin with, CBD is non-impairing. A lot of people say it's non-psychoactive, but that's not actually accurate, because if it can reduce anxiety or if it can improve mood, then it is having an effect on one's psychology, but it's actually not going to cause any impairment. So it's never going to make someone so that they, or I shouldn't say never, but very rarely would we ever see anyone be affected by CBD in a way that would inhibit their function or impair their function. Most of us know that CBD is an anticonvulsant. It has anti-epileptic properties, and that's one reason, or that's the only indication right now for the FDA approved CBD. It's anti-inflammatory via many mechanisms of action. It's an analgesic, so it can reduce pain. It's an antioxidant, which means it combats free radicals and the damage they cause in the body. Lesser known would be antifibrotic. So in many cases where CBD has been studied, whether it's in the organs or on the skin, it's demonstrated anti-scarring effects, anti-fibrosis effects. Anxiolytic means it decreases anxiety. Antipsychotic, this is another interesting one, typically shows up in the higher dose range of CBD, but there have been clinical trials with high doses of CBD head-to-head against an antipsychotic drug for people with psychosis or schizophrenia, and CBD works well in that setting with much fewer side effects than the alternative drugs. Procognitive, meaning that many people who use CBD experience increased focus or mental sharpness. And then neuroprotective, which means in the setting of a nerve injury, whether it's an acute injury like a stroke or a hypoxic injury, right now it's being studied in newborn babies that have decreased oxygen supply while they're coming through the birth canal, whether it's an acute injury like that or a more slow chronic nerve injury dementia or multiple sclerosis or any of these neurodegenerative conditions, CBD can protect the nerves and help them heal and prevent further damage. So how does CBD work? Over 65 distinct targets for CBD in the body have been identified. Now, this is based mostly in test tube studies, so it doesn't mean that these are all relevant when it comes down to the clinical activity of CBD, but CBD is not a molecule that has a single thing it does in the body. It does lots and lots of different things. So what are some that I find most relevant? Well, the first is that it inhibits the breakdown and reuptake of anandamide. Anandamide is an endocannabinoid, which is one of our inner pharmacy's compounds that it makes that has very similar activity to THC. Now, we're making endocannabinoids all the time. In the brain, we make them for the process of learning and neuroplasticity, which means making new connections between the nerve cells. We also make anandamide to protect us from injury and inflammation. And then elsewhere in the body, anandamide is also working as a homeostatic regulator, which means it keeps things in balance at the cellular level. And it has this ability to regulate all the other systems in the body. So by inhibiting the breakdown and reuptake of anandamide, CBD can increase the anandamide levels in the body and in the brain, which has a therapeutic effect that might be in a very mild way similar to THC, but not impairing. So then CBD does something that's almost opposite compared to that first, to this bullet point. CBD is a CB1 receptor allosteric modulator. So what that means is that, so you can think of a CB1 receptor like a little antenna on the surface of the cell. And this is the antenna that anandamide stimulates, and also that THC stimulates, and some of the other compounds we make in our body will kind of turn on this antenna, and that has this cellular effect for balancing out the activity in the cell. Well, CBD has the ability to interact with that receptor and turn down the volume on the effect. So it doesn't shut off the receptor, but it just makes it a little bit less active. So you've got these kind of balancing activities here. And on one hand, it's increasing anandamide activity by inhibiting its breakdown and reuptake. But then on the other side, it's making sure that that signal doesn't get too loud, which really creates this nice, comfortable, kind of safe zone of activity. In addition to what CBD is doing in the endocannabinoid system, which is what I just described, CBD is hitting other targets outside of the endocannabinoid system. Importantly, it's a serotonin receptor agonist. So most of you are aware that serotonin is the neurotransmitter that's related to happiness and feeling of contentment. It also has a lot to do with anxiety levels, as well as nausea. CBD activates that receptor similarly to the neurotransmitter serotonin. This is why CBD can be so helpful with anxiety and focus and other aspects of mental health. Then CBD also triggers the so-called capsaicin receptor. This is a TRPV1 receptor. It's an ion channel in cells. And capsaicin, which is the active ingredient in chili pepper, can be used not just for spicy flavor, but also for treating pain and inflammation. So CBD has that mechanism of action. And then CBD is also active at the glycine and adenosine receptors. Glycine receptors have to do with pain and inflammation, and adenosine receptors also metabolism, but it's interesting, adenosine is one of the targets of caffeine, and actually by stimulating the adenosine receptor, CBD would seem like it would make people sleepy, kind of the opposite of caffeine, even though we'll talk about sleep a little later on, and really people respond very differently to CBD in that regard. So then what about CBDA? As you might have seen, Healer came out with two products, one that's a formula that contains mostly CBD with a little CBDA in it, and one that's a CBD predominant formula. So how is it different? Well, first of all, CBDA does not have that activity at the CB1 receptor. It does not seem to decrease the volume of that receptor's activity like CBD does. There's also been no evidence that CBD inhibits the breakdown or reuptake of anandamide. So kind of these endocannabinoid system activities of CBD seem like they're not present for CBDA. CBDA does have higher oral bioavailability, which means it gets absorbed a lot better, 5 to 11 times better in the body than CBD does when taken orally. So that's quite significant. And then there's also some evidence based on animal models that CBDA is stronger than CBD, that it's more potent, not just because it's getting absorbed better, but that it's actually acting more strongly in the body. So here's just a few examples. And I see that the bottom of the slide got cut off. I'm not sure why. But both CBD and CBDA have been shown to reduce nausea and vomiting in a rodent model of nausea. While CBDA was antiemetic, meaning anti-nausea, at 5 milligrams per kilogram of body weight, CBDA was effective at 0.0005 milligrams per kilogram. So that's over 1,000. That's like 10,000 times stronger. It's hard to believe that this tiny dose of CBDA could be effective in the same rodent model, but it was. And then what's also interesting is that with CBDA, the dose response curve was not biphasic. Now what that means is at this 5 dosage of CBD, 5 milligrams per kilogram, you can reduce nausea, but when you crank the dose way up, you can actually make nausea worse. That did not seem to happen with CBDA. So that's just one example. There's also been a rodent model of hyperalgesia, which is hypersensitivity to pain. And in that model, CBD was effective at 10 milligrams per kilogram, while CBDA was effective, again, at 1/100th of the dose, 0.1 milligrams per kilogram. So in this pain inflammation model, CBDA was 100 times stronger. And then in a rodent model of seizure disorders, CBDA was shown to be 10 times stronger than CBD. So a lot of evidence pointing us in the direction that CBDA and CBD are very similar. They certainly have their differences, but CBDA seems like in many situations it can be a lot stronger. So just a little support to show you what I mean by higher oral bioavailability. This was a pharmacokinetic study, which means administering a drug to a series of patients. In this case, it was 9 patients, and measuring their blood levels for these compounds. And these patients received both THC, CBD, THCA, and CBDA all at the same time. And that was pretty easy to track. Now, here's just the data on the CBD and CBDA that I wanted to show you. So over here on the left is what happens when they take it in an oil form, which is what most of you would have the opportunity to do. And you can see time on the x-axis, and then on the y-axis is the concentration of these compounds in the blood. So look at this peak for CBDA. When taking CBDA, they reached 70 nanograms per milliliter in the blood. For CBD, it just stayed down here. Now, this is still effective. People feel a difference when they take CBD and it creates this blood level, but CBDA is just so much higher. And then consuming the two in the form of a decoction, which is I had this backwards, by the way. This is not oil. This is oil over here. On the left is decoction, which is like a tea. So but both are showing that CBDA is much more strongly absorbed than CBD. So what conditions can CBD help? I just get these questions all the time, and it's hard to answer because it can really help with a lot. But certainly the most common reasons that I'm seeing people use CBD would be anxiety, pain, topically for skin conditions, and then a lot of people like to use it for sleep. So I just want to focus in on those for now. Let's talk about anxiety. So there's data, you know, I want to, this isn't just about what's been published in the scientific literature. I'm very happy to share my clinical experience as well, which is that a lot of people who use CBD to treat anxiety report that once they get to a high enough dose, they experience a decrease in anxiety without the side effects that are typical from regular anxiety medications like sedation and confusion and things like that. They feel like they can remain mentally sharp and focused without the anxiety. And that's really a great distinction between CBD and some of the other treatments. So this was a case series, so not a randomized controlled trial, but I think this is very typical of what I see in the clinic. 72 adults at an outpatient psychiatry clinic were taking CBD, most of them 25 milligrams a day in capsule form. In 57 patients, anxiety decreased and remained decreased for the rest of the study duration, which was, I think, around 6 months. And then sleep improved in the first month for about half of the patients, but then fluctuated over time. So it seemed like the benefits of this fairly low dose of CBD, 25 milligrams a day on anxiety, were a very high response rate. So about 80% of people with anxiety that tried this 25 milligram dose had an improvement that they reported in their anxiety, and that improvement was maintained over time. And I also see that in the clinic. When someone responds to CBD, I typically don't see them building tolerance or losing efficacy over time. Now, this hasn't been published, but this is data that was presented at a conference that I wanted to share, because it was just 4 weeks of treatment with a CBD dominant product that was produced by the National Institute of Drug Abuse, a full spectrum so-called CBD product, but we never learned any more about what was actually in it. But it was, again, a low dose, 10 milligrams TID, which means 3 times daily. So these were patients with anxiety that were just taking 10 milligrams 3 times daily. And overall, there was an 80% reduction in anxiety over the course of 4 weeks. There were also improvements in depression and mood, and improvements in many cognitive domains. So this researcher, Stacy Gruber, does a lot of cognitive tests to assess how sharp people are thinking and how fast they can learn. And so almost every cognitive domain improved and anxiety got better. There was just one test where there was a very small detriment in learning ability. And it was barely measurable, but the general direction was an improvement in cognition. They continued for 6 months. They maintained their benefits for 6 months. They also had improvements in sleep and quality of life with no adverse effects. CBD is incredibly forgiving. And at 10 milligrams 3 times a day, very few people are ever going to have an adverse effect from this treatment. Now, there's been some studies that have looked at very high doses of CBD for treating anxiety, and I just wanted to show you one of those because a lot of people are thinking in the double digits, and that's what most people can afford. But also these really high doses of CBD can be safe and effective. But what's really interesting is the dose response curve. So this was a study where they take people and they make them do public speaking, and it causes anxiousness. And basically that anxiousness is measured on this scale here. And then this is basically before, during the preparation, during the speaking, and afterwards. And the levels of anxiety went up for everyone while they were doing the public speaking. But looking at the data, there were 3 doses of CBD given, 100 milligrams, 300 and 900 milligrams. And what you can see here is that 300 milligrams significantly outperformed both the 100 and the 900 milligram doses. 300 milligrams actually outperformed clonazepam, which is a benzodiazepine, very strong anti-anxiety medication. So I bring this up to show you that more is not always better. And there might be some of these so-called U-shaped dose response curves, even in the lower dose range. And so for someone that's using CBD, if they increase the dose and they get a better effect, especially with anxiety, they increase the dose again and they get an even better effect, and then they increase the dose again and the effect seems to start to diminish, increase it again, and they're not getting the results they were once getting. They've probably gone too high. And just like with THC, sometimes by lowering the dose, you can actually get a stronger therapeutic effect. It doesn't make a lot of sense when people think about it. They think, oh, I should take more and I'll get a stronger effect, but sometimes taking less produces a stronger effect. So let's switch gears out of anxiety. I think CBD is extremely useful for anxiety. I put that first because that's probably the most common reason that I'm using CBD in the clinic is for treating anxiety and also cognitive function. But let's talk about pain and then also opioid use, because there's some interesting data here as well. So this was a cohort study, which means they did compare people using CBD and those not. But this was, again, a fairly low dose for people with chronic pain. So 97 people did this for 8 weeks, older average age, 56, moderate to severe chronic pain for greater than 3 years, and stable on opioids for at least a year. So I think most clinicians would see this patient population as difficult to treat. You know, these are people with chronic pain that have been taking opioids. They still have a lot of pain. What are we going to do for them? So in this study, they provided hemp-based CBD capsules that contain about 15 milligrams of CBD and half a milligram of THC per capsule. Most people in the study used 2 of them a day. So again, we're in the same dosing range you saw in the anxiety studies, about 30 milligrams of CBD daily. What were the results? 94% of the CBD users reported improved quality of life on subjective open-ended questions. 2 reported completely eliminating their opioid use, and others reported deliberately skipping or forgetting doses of opioid medications. Some missed doses every day, and others did so irregularly. So again, this is a major win in this sometimes challenging to treat patient population with relatively low doses of CBD, about 30 milligrams total daily, and a little THC in there from a hemp-based formula. Now, this is something that's really interesting, and it may not directly apply to many of you that are listening, but I'm showing you this study to point out that while CBD can have some short-term effects just while you're taking it, it also seems like it can have some really profound long-term effects, even days or a whole week after a person has stopped taking it. So this was a double-blind study performed on people that were heroin addicts who had been abstinent from heroin and were still having cravings. Okay, and the design of the study was to give someone either a dose of CBD or a placebo drug, and then show them a video either of nature scenes or a video of someone using heroin. And basically the video of someone using heroin would create a lot of anxiety and create a lot of cravings in these patients that were abstinent. And the goal was to find out, does CBD decrease the anxiety and the cravings? And they looked at this in the short term, so 1 hour, 2 hours, and 24 hours after taking the dose of CBD and being exposed to those videos. They looked at the results after 3 consecutive days of treatment, but then they also checked back in with these people a week later, not having any CBD for a whole week, and they retested them. And it's just amazing what happens. So I'm going to show you anxiety. The results for their level of craving were very similar, but this is just 1 to 2 hours after either CBD or placebo. And you can see this is the change from baseline. So if they were shown the nature scenes, which is called the neutral cue, their anxiety went down a little bit. And if they were shown the heroin using scenes, their anxiety went way up. Taking a 400 milligram dose of CBD prior to this test, you can see, strangely, it made the nature scenes less therapeutic, but it also cut way down on the anxiety level experienced from the heroin scenes. And then the high dose of CBD, 800 milligrams, cut that anxiety level down even more. Now, if we look at the next session, which was 24 hours later, you can still see that compared to placebo, it's not as strong of a response, but even 24 hours later, showing the nature scenes, showing the heroin using scenes, there was still a reduction in anxiety. But what's just so impressive is that 7 days after receiving the CBD, so no CBD for a week, and then rechecking this test, you can see the level of anxiety in the placebo group when they were shown the heroin cues. Look at this. A week later, in both the 400 and 8 milligram CBD groups, anxiety was either reduced from baseline or almost nothing. I think that's just so impressive. And what we know about how CBD and some of the other cannabinoids work is that they're not just temporarily relieving symptoms, but that they're also working on our neuroplasticity, which is our brain's capacity to make changes, to make new connections. Every time we learn something, we're making a new connection. Every time we heal from a stroke or a neurologic injury, there's thousands, millions of new connections being made. And as we age, for a number of reasons, our brains and our neuroplastic capacity becomes less plastic, more rigid. And so I think having something that can have this prolonged effect and actually allow people to change their patterns of thought and behavior and not just temporarily relieve symptoms, that's very exciting for me. So I do think that CBD has a lot of promise when it comes not just to treating pain, but also treating pain in the setting of opioid use and of helping people that have cravings and anxiety around opioid dependence or opioid abuse. Now, moving on, I want to talk a little bit about topical CBD for pain and spasticity and for skin inflammation and scarring. So I've seen a lot of mixed results, I'll say, in my practice. Some people love topical CBD and it works incredibly well for them. Other people have tried it and said they felt nothing. I suspect it has a lot to do with the formulation, and we're learning from those experiences and doing our best at Healer to make a formulation that's highly effective. But let's just talk about what the literature supports, because I think that for people that have localized pain and spasticity, a trial of CBD is very safe and could be highly effective. And then also for skin conditions that involve inflammation and scarring, topical CBD is also very attractive. So this was a study in people with temporal mandibular disorder. So this is pain here in the TMJ area. 60 patients, a double-blind study. They were applying either a topical CBD ointment or a placebo twice daily, just for 14 days. And over that time in the CBD group, the masseter activity, which is the intensity of the muscle contraction here, was reduced by 11 to 12% in the CBD group versus almost nothing to 3% in the placebo group. So compared to placebo, this was a very significant improvement. Also, there was a reduction in pain intensity that was even a higher magnitude. So 70% average reduction in pain. And this is a difficult to treat condition versus only 10% in placebo. And I've listed, what's in the formula, but I think the take-home message there is that this is a joint and a muscle that's very close to the surface. We don't have discrete evidence that CBD is penetrating into the joint. That hasn't been studied to my knowledge, but it seems like if people are able to get such a profound effect compared to placebo, there's probably some local absorption, and it's having an anti-pain, anti-inflammatory, and muscle relaxant effect here in the jaw. And I suspect, based on my clinical experience, that it can do that elsewhere in the body, probably especially in areas that don't have a lot of subcutaneous tissue, where it's just very close to the surface of the skin. So then there was another study published from a dermatology group looking at skin parameters and results when using CBD ointment in skin diseases and scars. And they measured this in a variety of different conditions. And they looked at the hydration of the skin, how the water was lost through the skin, the elasticity of the skin, and how the skin looked on photographic assessment. And in all 20 patients that they tried the CBD ointment on, there was an improvement in symptom severity and quality of life. 20 out of 20 successes. And I'll just show you some of the pictures. So these are cutaneous blemishes, and you can see before treatment over here. This is also called senile purpura. It's a condition where the blood vessels in the surface of the skin can get very fragile and cause these marks. And you can see that totally resolved with the CBD treatment in both of these cases. And then another one, which I found really interesting, and I've seen some impressive results with scarring as well. So this was a cyst removal that had a big scar on it after the surgery. And you can see this was mostly healed up. It's not like they started this treatment right at the time of the surgery, but even topical CBD applied to the scar, you can see what a big difference it made over time. So I think that there's a lot of potential for CBD in dermatology. It seems to have anti-acne effects, certainly the anti-scarring and anti-inflammatory effects. So a lot of potential use there. Now let's talk about sleep. So this can be kind of confusing because I have so many patients that report CBD helps me with sleep. And then I have quite a few patients that report CBD keeps me awake. If I had to guess, I'd say maybe it's somewhere around 10% of the patients that try CBD for sleep say it keeps them awake. And then there's a number of people that it doesn't help them sleep or it doesn't keep them awake. It just has no real effect. So what do I recommend? Well, because I have the luxury of practicing here in Maine and we can use THC products for sleep, that's usually my first line approach, unless someone has a history of not responding well to THC or just a personal preference to avoid THC, we might try CBD. But what I observe a lot in the clinic is that when people are taking CBD during the day, they tend to sleep better at night. And maybe that's because they're less anxious or something's more balanced in their neurophysiology. I don't really know what it is, but I've had this report a lot that by taking CBD with breakfast and lunch, then they find that when it comes to sleep, they're able to get better sleep. If then for some of the people that find that CBD is too stimulating and it actually keeps them awake, this can be related to the dose. So some people, and I found this more often in children, but certainly in some adults, if a lower dose is disturbing them and making them feel a little more awake and activated, they can actually go to a higher dose, like something more than 30 milligrams, and that can create a more sedating effect. So something to try if you've been using CBD or if you're confused by the effects of CBD on sleep, it can be dose related. But certainly if someone's having major problems with sleep and CBD is not effective, then based on my experience, THC is really the go-to treatment. So what about using CBD or CBDA with THC? There's a lot of potential here for these compounds to work well together. So I just want to describe a little bit of that. So to begin with, we talked about how CBD turns down the volume on that CB1 receptor. This is why a lot of people like to use CBD with THC, because it makes the THC less intense and more tolerable. It doesn't block the effects of THC totally, it just makes them a little bit less powerful, and that allows people to take a higher dose without getting side effects. So if you think about the therapeutic window, which would be like, if this is the dose that creates a therapeutic effect and this is the dose that creates a side effect that's undesirable, then you want to be somewhere in there with your dose. And with THC, that can be kind of narrow. By adding CBD to THC, you can broaden that therapeutic window. Now you have more room to play around with the dose with a lower likelihood of getting adverse effects. While CBD is mitigating the adverse effects of THC, it's also adding some of its own benefits, because the way that CBD works on anxiety and works on pain and inflammation, these are distinct mechanisms of action from THC. So when you combine them together, you get this beautiful synergy, but you get less of a powerful THC effect. Now that's good for most people, but there's also some people that find when they add CBD to their THC, the whole treatment gets less powerful. Also, not just the side effects, but the therapeutic effects become less powerful. And some people, for that reason, don't like CBD. They want the full power of THC to shine through. Well, so this is one of the benefits of combining CBDA with THC, because CBDA does not change the intensity of the THC effect, but it adds all these other benefits to the THC that we've talked about before. So they really make a nice combo, CBD and THC or CBDA and THC, but it really depends what you're looking for. And so for those that are really wanting THC to exert its full effect, I would recommend try combining that with CBDA. And what you might find is some of the beneficial cognitive effects like focus and mental clarity, as well as decreased anxiety and additional anti-inflammatory and anti-pain effects without diminishing the power of THC at all. So these are my strategies for people that are already using THC. And just to reiterate, choose CBD if you want to decrease the psychoactive or adverse effects. Choose CBDA if you want the full power. And then something that I found very useful for people who take THC at night, if they take a little too much and they're feeling like, wow, THC really helped me sleep, but I'm waking up kind of stoned or groggy, then a morning dose of CBD can really help clear that up and get someone going for the day. So CBD is quite good for that purpose. What about taking CBD with other drugs? So first of all, there are no what we call contraindications. There's no drug out there that makes it so you can absolutely not take any CBD. But there are some drugs that we're cautious with. And the main reason for that caution is that when CBD is getting broken down in the liver, it's via an enzyme called the CYP450 system. And this system of enzymes that breaks down drugs has certain varieties. The two that break down CBD are the 3A4 isoform and the 2C19 isoform. And so basically any other drugs that are metabolized by those same enzymes could theoretically get metabolized more slowly, get broken down more slowly if taken in the presence of CBD. And so you might end up with higher blood levels or a stronger effect of some of these other drugs. So warfarin, the anticoagulant drug, the blood thinner, this is also known as Coumadin. This would be one that if somebody's adding CBD, they would want to have their blood checked and make sure that their dose of warfarin doesn't need to be adjusted, typically decreased. Some of the strong antifungals, which can use a lot of liver resources, can interact with CBD. But all of this is now present in online drug interaction checkers. So if you have a list of medications, you can go online and check them with CBD, because now CBD is an FDA-approved drug in the US, and that's why it's included. There's two seizure drugs, clobazam and valproic acid, that can have some interactions with CBD, but I'm sure anyone that's on them would be talking to their neurologist before adding CBD, or I at least hope they would. So what's the difference between CBD isolate, full spectrum, broad spectrum, healer spectrum? There's just a lot of questions around this. And so, let me start out by saying, in general, not just with cannabis, but with herbs in general, there are synergistic effects amongst these many phytoconstituents. We talked about this earlier. Nature tends to make things in a lot of slightly different varieties, and usually those different varieties work together. Sometimes they enhance the absorption or slow down the breakdown of the drugs. Sometimes they have what we call pharmacodynamic effects, which means they're actually hitting similar but slightly different targets in the body and working together that way. And this is absolutely the case with cannabis. We see that CBD works well with THC, but we see that all of these cannabinoids tend to work really well together and with their terpenes. So when we take the cannabis plant that produces a CBD dominant profile of cannabinoids, there's also going to be minor constituents in there. So dozens or actually hundreds of minor cannabinoids. Many of them don't even have names. Some of them aren't tested by our testing labs in the States, which usually focus on somewhere between 8 and 12 cannabinoids, but they're in there. And the evidence we have shows that many of these minor cannabinoids, even though they're present in just trace amounts, they can make a profound therapeutic difference. And this is seen both in clinical and test tube type studies. So when someone's using something called an isolate, this means that the CBD has been isolated from these other compounds, and what you're getting is something that's more similar to a pharmaceutical. It's like one molecule, it's just CBD, very easy to measure how much is in there. It can be very dependable, very reproducible. There are certainly some benefits to taking CBD isolate, but for most people, in my opinion, and what the research has shown, is that's going to be less effective than taking a product that has the same amount of CBD, but also includes trace amounts of all these other constituents. Then there's the so-called full spectrum, which is something that a lot of products advertise. They say that our products contain the full spectrum of everything that's in the cannabis plant. And I'm just very cautious with that term, because in my opinion, anytime you take the cannabis flower and you start processing it, you're not going to be ending up with the full spectrum. There's going to be some losses, no matter how careful you are. So to me, full spectrum means going out to your garden and taking a CBD flower and popping it in your mouth and eating it. That's full spectrum. Everything else I would consider broad spectrum, which means people are doing their best to not lose these compounds during processing, but actually to include them in the final product. And I think there's a lot of companies out there that are really striving to do that. Healer is one of them, because from the early days when I started treating patients with CBD products, and also just with cannabis in general, I was very clued into the therapeutic power of some of these trace constituents. We had a testing lab here in the clinic, and I was noticing, wow, there really is a difference between different products, and that difference sometimes isn't the main actor, the active ingredient. Sometimes that difference is really these trace compounds. So when we developed the Healer products, we first developed an extraction and formulation technology that would enable us to take everything good out of the cannabis flower and process it with very low amounts of pressure and without heat. It's a cold process, and that's designed to retain all of these medicinal compounds as much as we possibly could. And I'll be honest, we do lose a few things, but I think that if you look at what's in the Healer product, you'll probably see that we contain higher levels of the trace cannabinoids and the terpenes, which are the compounds in cannabis that give it its aroma and also have therapeutic properties. The Healer spectrum preserves this, and we're able to do this while cleaning up the cannabis through a patented technology that we developed using nanofilters. These are filters similar to what's used in the water industry, but we adapted them to work with cannabis extracts, and that way we can kind of capture everything that we think is valuable and leave all the contaminants out. So that's the Healer spectrum, and that's the process we use to make our hemp products, and that's why we're able to make a CBDA product without converting the CBDA to CBD, because with heat, CBDA will become CBD, and that's why a lot of the CBD products out there, if you look at their laboratory results, they don't contain any CBDA, not even a little bit. That's because they were heated to the extent that all the CBDA converted. So what you get in our CBDA product is basically very close to what was harvested in that hemp plant, really, really close to what the actual flower shows. So there is a little evidence that these artisanal or broad spectrum products work better than purified CBD. I think probably the strongest is this review article that looked at 11 papers on the benefits and effects of CBD on epilepsy. And there were 670 patients in total that were evaluated in these 11 papers. And in summary, what they found was that in treating people with seizures, those that were using a more broad spectrum formula had a 71% response rate. So 71% had a benefit in their seizures compared to only 36% in those that were taking purified CBD. As far as really good results, meaning a greater than 50% reduction of their seizures, they were about equal. Actually, the purified CBD had a slightly better result in that measure, but look at the dosage, the average daily dosage. So this is per body weight, the number of milligrams of CBD per kilogram of body weight. This is an extremely high dosage here, something that would be cost prohibitive to most people. And over here you can see less than a quarter of the dosage is what was used with the CBD extract, so more of an artisanal formula. And then also you can see that as far as mild and severe adverse effects, much less common in the group using the CBD-rich extract. So what I take away from all of this is that often when people are using a formula that is not just CBD, but is broader spectrum, they're able to get better results at a lower dosage. And by using a lower dosage, that means they're less likely to have negative side effects. The other thing that was reported in this study, they didn't have this for the CBD pharmaceutical group, but in the CBD extract group, the artisanal medicine group, there were all these side benefits. So over half of people said they became more aware. A third had better sleep. 30% had better mood. There was a decrease in behaviors and aggressions. Language improved in some of these, probably pediatric patients with developmental delay. And then also their motor skills improved. And I highlight these common adverse events because I want to talk about the side effects of CBD. First of all, it's very well tolerated. A lot of people can take it even at high doses and have zero side effects. But when I do see side effects, it's typically what was reported in this paper. So appetite alteration, and it's usually decreased appetite. That's one of the most common. And then other kind of vague gastrointestinal disturbances, whether it's a little nausea or a little bit of diarrhea. Then the fatigue or sleepiness is another common side effect. But what wasn't caught in this group that I would certainly put high on this list would be restlessness. And so it's not an anxiety, it's just feeling like, people describe it like they've had too much caffeine or something like that, and they just can't sit still, or at night they can't wind down and relax enough. So that would be another more common side effect. But when I say common, I don't really mean common because just so many people are able to take CBD without ever having a side effect. So then I've had some questions come into Healer. What about liver damage? So first of all, I want to say that there's been a lot of data on CBD, both in animals and humans. And there's been one paper that shows it can cause liver damage. And it was a very strange paper. So they were giving they were giving mice very high doses of CBD using the FDA approved CBD formula. And what's really strange is that in this study where they were giving kind of a high dose over the course of a week, or no, it was 10 days, they found that a quarter or 3/4 of their mice died between day 3 and 4. But what's so strange is when you look into that study, there were 6 mice in this group. So how do you get 75% of 6 mice dying within days 3 and 4? It's just, you know, I don't know, but probably a lot of you saw these headlines that came out about CBD being toxic, and a lot of people got really worried about it. But I wouldn't let these 4.5 mice scare you by any means. I hope that it becomes humorous to you and not scary, even though, you know, I am thankful for all of the animals that have gone through all the suffering that they've gone through to give us scientific information about this stuff. So it's not funny from that standpoint, but the fact that these 4.5 mice made headlines is pretty strange. Now, just to prove to you that CBD is safe, this is a study from a year prior, not in mice, but in healthy human beings, given extremely high doses of CBD. Look at this, 6,000 milligram single doses. And then some of them got 1,500 milligrams twice daily for 6 days, using the same exact formula that was given to those mice. And what they found was that there was, first of all, no change in any labs, no sign of any liver injury, no kidney injury, nothing. No change in their labs at all, no change in their physical exam, their vital signs, their ECG, meaning their heart monitor, or their body weight. The adverse effects from the super high doses were diarrhea, nausea, headache, and tiredness. No consistent effect of CBD on sleep or sleepiness. I think that's a theme that's coming out. Why no consistent effect? Because people just are different. And some people respond one way and some people respond the other way. And then no evidence of any withdrawal syndrome. So to me, this study, which included a placebo group and was run in humans with extremely high doses, is much more informative than 4.5 mice. And I'll leave it at that. Well, actually, one other thing I would comment is not only is CBD safe for the liver, but there's also evidence that CBD can be healthy for the liver and prevent scarring and cirrhosis of the liver. There's some indication of that from the preclinical studies that are out there. So that study supported twice daily dosing of CBD based on how quickly it's absorbed and broken down and excreted. It seems like most people will do well with twice daily dosing. And then I like to emphasize the second point because they were measuring blood levels of CBD, and what they found was that when it's taken orally with a high-fat meal, people were absorbing 4 to 5 times as much CBD as they absorbed when they were fasting. And so I think this is just such a simple way to make CBD more cost effective. Take it with a little bit of fatty food. And it doesn't even have to be a whole meal, in my opinion. It can be a snack would be fine. So let's move on now to CBD products. What is going on with CBD products? Well, I think one of the main problems is that this industry grew very quickly. And a lot of the companies that have gotten into making CBD products didn't have a background in nutraceuticals or herbal medicines or even pharmaceuticals. A lot of them were just brand new companies coming along, and maybe some didn't have the patient's best interest as their top priority. So there's been a number of these reports, and I don't want to dwell on them. I'm just going to show you a few investigative reports. So this was the I-team out of New York tested 5 samples of each brand, 3 different brands of oil and 4 brands of gummies. So not a huge survey, but what was available in New York last year, or about 2 years ago almost now. One brand contained 4 times the amount of lead than approved. And this was a quote from the person they interviewed. If a child gets their hands on these products, that could be life-threatening. One sample contained a pesticide that exceeded California's acceptable standards. But maybe even more importantly, less than half the samples had the stated amount of CBD inside the product. And so while I think we can rarely get these highly contaminated products, they're out there. You know, I think that's probably less common, but what's more common is that the label's just not accurate and people don't know how much CBD they're getting. So out of the 4 gummies they tested, 2 had less than half the amount of CBD advertised and 1 contained 0 CBD. And then out of the gummies, all of them contain 0 CBD. So people are basically paying for these gummies that are advertised as having CBD, but really don't. Here's a similar report out of Austin, but this was a lot more thorough because they tested 240 different products for 300 different contaminants and for labeling accuracy. So a lot of time and money and energy went into this research. And they found that 70% of the 240 products were highly contaminated with heavy metals like lead, arsenic, herbicides like glyphosate, pesticides, BPA, and toxic mold. So that's 70%. And one product had lead levels that were 100 times the EPA maximum for drinking water. Now, we need to compare apples to apples. These highly contaminated foods with pesticides and even heavy metals, you know, that's not drinking water. That's, you know, a little gummy or a little bit of oil. So it's not like people are exposed to huge quantities of this. And you could probably go to the grocery store and buy some conventional strawberries or apples even that haven't been grown organically. And they're likely to have very high levels of pesticides and maybe heavy metals on them as well. So I like to kind of keep it in context, but when people are doing something to support their health, I would love for them not to have to be exposed to these toxins. More than half the products had labels that inaccurately reflected the concentration of CBD in the product, ranging from no CBD at all to 6 times the potency of what the label read. So I think you get the point. This industry has a lot of problems and it's hard to find products that are trustworthy. And then this isn't just investigative reports by news channels. This has also been reported in the scientific literature, including the Journal of the American Medical Association, looking at 84 CBD products from 31 companies. 26% of them contain less CBD than labeled, and 43% contain more CBD than labeled. So again, we're about 1/3 of the products accurately labeled based on this study. So how do you find a good product? Well, I think one of the most important things is the certificate of analysis, or COA. And what this is basically showing is that the company has tested their final product and is willing to publish those test results so that you can take a look at them and understand, is their product clean and is it accurately labeled? And I'm going to go through a COA and show you how to read it. There's also, the other question would be the presence of the entourage compounds. So does the CBD product have a little bit of THC, a little bit of CBDA, some of the terpenes, some of the THCA? If the answer is yes, then I expect that it's going to be a more effective product. Then you also want to look at the other ingredients. Some products actually contain things that you wouldn't expect, like other herbs and drugs. Sometimes that can be a good thing, sometimes bad. It's nice if you can know something about the farming practices and where the CBD was grown. Unfortunately, a lot of the products in the CBD industry are what they call white labeled, meaning one factory produces them, but then slaps a bunch of different companies' branding and label on them. And it's just, the final product is quite disconnected from the starting material. And then trust. I mean, even with a good certificate of analysis, you know, of course, these things can be forged, and sometimes labs don't have the most honest procedures and can be paid to misreport things. And, you know, so I think even if you do your due diligence and check all the data, it's still important to find a company that you can trust. So let's talk about the COA. Here is, this is from our hemp product, the infused MCT oil. So just getting oriented here, you can, this is the first page which looks at the cannabinoids. And so you can see all these different cannabinoids here. This is THC. There's just a little bit of THC. And this is the percent by weight, but oops, and I think that's less important. What's more important is the concentration. So in each milliliter, which is like a full dropper, our CBD product has 1.5 milligrams of THC. It also has, if we look down at the biggest line here, 39 milligrams of CBD. And then it's got intentionally some CBDA. There's 6 milligrams, 6 1/3 milligrams of CBDA. And then you can see trace quantities here of CBDV. There's a little of that. There's some CBG in there. There's some CBC in there. There's no CBN. CBN is a breakdown product of THC, excuse me. So when THC gets exposed to ultraviolet light and a lot of heat and things, it breaks down into CBN. So the absence of CBN shows us that this product is very fresh and that it's been well produced without a lot of heat. There's a little CBGA in there. So you can see this really is what we would call a broad spectrum formula. From the cannabinoid standpoint, it has a lot of these minor cannabinoids in it. The total concentration is right around 50 milligrams per ml, and that's what we advertise, 50 mgs per milliliter. And you can see that about 40 of those are CBD, and the other 10 milligrams per milliliter are all these trace cannabinoids mixed together. So moving on, this is our CBDA product, and you can see that it looks quite different from a cannabinoid standpoint. So here we have this really strong purple bar here. That's the CBDA. Again, you can see that there are some of these trace cannabinoids present. There's some CBGA, there's some THCA. There's just a little bit of THC, again, because this product has not been heated. And so CBDA turns to CBD when it's heated, THCA turns to THC when it's heated. So that's why it has even less THC in it. But again, you can see these trace quantities of a lot of the other cannabinoids, and the total potency as advertised is right around 50 milligrams per milliliter. So those are our two different products. Now, this is just the CBD product, and you can see here the terpene results. So this is the terpenes profile. Again, terpenes are the compounds that give cannabis their, the different varieties of cannabis, their distinct aromas. And the different levels of terpenes in varieties of cannabis can be responsible, at least it's theorized, be responsible for their distinct effects. And so you can see here we have a broad range of terpenes. Alpha-pinene, and myrcene and beta-pinene are the ones that there's the most of. There's also quite a bit of beta-caryophyllene, which is a good anti-inflammatory, a little linalool, and a little limonene. So I don't want to go through all of these and tell you what they mean, because actually these compounds have a lot of physiologic activity, and sometimes it's overlapping and multifactorial. But what I can say is that beta-pinene and alpha-pinene have both been associated with improvements in memory and focus. Myrcene has been associated with decrease in pain, but also with sedation. Limonene has been shown to be an antidepressant. Beta-caryophyllene, an antioxidant. Anti-inflammatory, as I mentioned before, and that actually works through the cannabinoid system via the CB2 receptor. So again, the main point here is you want to look at the lab results and see, wow, this product has a lot of terpenes in it. And if you look at the overall terpene content, this product has about 0.3% by weight. So in the other page, when I was showing cannabinoids, I was pointing out that it's better or easier to look at the number of milligrams per milliliter. But when you're comparing products with terpene content, you can just say, well, what's the overall terpene content? It's 0.3%. And then is there a variety of terpenes, or is it all just one or two different terpenes? And then the contaminant testing. So this was looking at, first of all, volatile organic compounds, propane, isobutane, butane, methanol. These are all toxic and so forth. And you can see we had ND means non-detected. So what was in the Healer formula? Well, there was some ethanol in there, almost 3,000 parts per million. And that's because we use ethanol to extract all the good stuff from the cannabis flowers. And then we take all that stuff from the ethanol and we get it into an oil so that it's more palatable and so that it stores nicely. But there's a little bit of ethanol left over. And so I just want to put that in context for you. A peach stored at 68 degrees Fahrenheit for 64 hours with no oxygen, meaning it was stored in nitrogen. This is from Food Science paper. Had an ethanol concentration that was similar to what's in our CBD products. So even unripe fruit has ethanol in it because the bacteria turn the sugar into ethanol, essentially. But ripened fruit has even much higher concentrations of ethanol. And if you think about how much CBD you're taking, we're talking about the number of drops. it's very far from eating a whole peach. So this is a long way of saying this amount of ethanol here is not enough to get anyone inebriated by a long shot. Then our test results came back with a very small amount of isopropanol. And I put this on the page because I want to discuss this. We were very confused by this result because we have 0 isopropyl alcohol in our whole facility. And we have no idea how they could get a result like this. Now, this is an extremely low level. It's far below what the threshold is, set for this USP recommendations for residual solvents, which was adopted by Massachusetts and some other states. So it's really far below the limit, but we don't think it was isopropanol. We think it was some other compound that had a similar molecular weight and structure to isopropanol and showed up on this test, but we don't really know for sure. Even if it was isopropanol, this would not be a toxic level of it, but we really don't think there's any way that isopropanol got into our product. And I'm happy to answer any other questions about that. Then you can see we tested for heavy metals. So our product is free of arsenic, cadmium, mercury, and lead, and then also free from any microbes. So no aerobic bacteria, no coliform bacteria, no gram-negative bacteria, and no detectable yeast and mold. And that is because our process very specifically removes these microbiologic contaminants. So this is what we do to test our products. And I think that if you're looking at another potential product, it would be really nice for you to be able to see that, wow, this has this variety of cannabinoids and terpenes, and that there's a certain percentage of terpenes in them, that it's accurately labeled, and that it's free from these contaminants. So that's exactly what you should be looking for. The other thing to look for would be a batch number. So all of these have a test date, and I'll show you at the beginning of the report. Well, I guess it's on here too, a certificate ID number and a batch number. And so you really want to match that to the product in hand, because if the company tested a batch that they made 2 years ago and it all tested clean, that might have very little to do with the product that's in your hand right now. So look at the date, look at the batch number. Oh, I forgot to show that we have even more results. So we also tested for other microbes, no salmonella, no E. coli. We tested for mold toxins. These were not present. So even if the mold itself isn't there, sometimes the mold can leave toxins behind. You don't want aflatoxin or ochratoxin. They're both very poisonous. And then we also tested for pesticides. And of course, our material was grown organically, but you can see there were none of these pesticides. So quite a long list of pesticides, nothing detected in our products. And then you can see here, we have the batch ID number, which I pointed out to you on the lab test. And we have a QR code that allows you to just scan the code and get the test results. And our products have been certified clean by the Maine Organic Farmers and Growers Association. And the reason they're not certified organic is because it's not really legal for that organization to call cannabis organic right now based on some red tape, but they can say that it's certified clean and that it follows the same standards as organic. And there is the field. So this is in Maine, not very far from where I live. It's a beautiful place where hemp was growing up to about a week ago. They just harvested. Here you can see me holding something that's very exciting. This is a CBG dominant variety. So our partner farm grew some CBG hemp plants that I'm also quite excited to make some medicine and start testing using this starting material. So hopefully that'll be becoming available soon. Wow, we've done a lot. I'm just going to cover a little bit more and then we can move to any questions. So delivery routes. A lot of people are wondering what's the best way for them to take CBD or cannabis in general. And essentially the route of delivery has a lot to do with the onset, how quick it can work and how long it lasts. And so when you take cannabis drops or CBD drops, there's a likelihood that you're going to absorb some in the mouth. Now, a lot of people, when they use our formulas, can feel a little bit of a burning sensation, and that's actually more in the back of the mouth and in the throat than under the tongue. But it's still nice to put them under the tongue. There's a lot of blood vessels there. You might absorb some, but that mild burning sensation is likely the feeling of these compounds being absorbed, coming into contact with the mucosa in a way where they can move across into the bloodstream. And so because of that, you'll get a little bit of a faster onset versus just waiting for a capsule to dissolve in the stomach and eventually be released in the intestine and get absorbed into the blood. The capsules go first to the liver, get broken down, and then over to the systemic blood circulation. So really, it's possible to have a much faster response with drops, and a lot of people have been reporting that to me. And topicals, we talked about the benefits of topicals, and then the inhaled cannabis, you know, hands down the fastest onset. You can inhale CBD or inhale other types of cannabis products and experience relief within a minute, sometimes as much as 5 minutes, but it's super fast. It's great for episodic symptoms, like if somebody doesn't need to treat themselves every day, just once in a while, they get nausea or get a migraine or something like that, really nip it in the bud with inhaled. And also good for breakthrough symptoms. Maybe they have their daily CBD dosing down. They know what works for them on most days, but something came up today and I'm having a really rough day and I need a little extra and I don't want to wait, you know, for one of these delivery methods to kick in. You can use a little inhaled CBD or inhaled cannabis and get really fast results. Common mistakes with CBD: not finding your optimal dose, not holding it in your mouth or taking it with food. 2 strategies to improve absorption, not trying it for long enough. So while a lot of people get kind of very fast results with CBD, maybe the first day or 2 that they try it, other people, it's more of a cumulative effect and they need to give it a couple weeks before they know if CBD is going to work for them. And so this is a problem I see a lot. People say, I tried CBD, and then I dig in and I say, well, how much did you take and how long did you try it for? And it turns out that it was a low or moderate dose for just a couple days. We get them back on it at a higher dose and for a longer trial, and they're finding the benefits. Inconsistent use, some people can just take it as needed, one day here, one day there, but other people, it really does better with consistent use. And that probably has to do with its anti-inflammatory effects. And then some people just don't know if it's working or not because they're not tracking their results. And I like to make that easy for people so they can understand where they were at before they started taking it and where they're at afterwards. That's why we have this healer tracking guide in our CBD usage guide, which makes it really easy for you to just kind of write in the date, how much you took, and then we can practice this inner inventory, which is a very fast way of checking in with yourself and understanding how you're feeling. So you get the before and after of taking the CBD, and you can see, has this really changed how I feel? I usually am recommending people start off with about 5 milligrams, that's 5 drops. So they'll do that for 2 days. If they're not satisfied with the results, go up to 10 drops for 2 days, 15 drops, and so forth, just creeping up by 5 milligrams every other day until they experience the results they're looking for. And if somebody's getting in the range of 35 or 40 drops and they're not getting results with CBD, then that might be a good time to switch over to CBDA, because CBDA can be more potent, or to add a little THC to the CBD to make it more potent. So taking it 1 to 3 times daily with meals, trying CBDA if CBD is not effective, and then adding the THC. And it doesn't have to be a lot of THC. It could be a quarter of the THC or even less, and you'll still kind of potentiate and get stronger effects related to the CBD. So that is what I have for you all tonight, but I'm very happy to go through and answer questions as well. Thank you all for joining, for hanging out for over an hour together. If any of you are interested in purchasing the products, there's a 25% discount code webinar. And then also I offer personalized education consults. So if it's a complex case and you really want someone like me to understand kind of the current medical situation and give more individualized advice on whether cannabis or CBD or whatever could be helpful, then we can set that up through my clinic as well, and the phone number is there. So thank you so much, and I will stop the screen share and get back to oh, I see there's a lot going on in the chat, which I didn't see from while I was presenting, but thank you. Looks like there's a lot. So so what else? Yeah, I guess there's a couple things I missed. I didn't show it on the COA because it was actually a different document, but the healer products have also been tested for flavonoids, which are anti-inflammatory and kind of protective compounds found in a lot of plants. And our method of preparation does preserve the flavonoids as well. That's been shown to be present in our products. And wow, there's probably too many questions for me to scroll through and answer. So where should I start, Simone? Shall I go over to that spreadsheet, or maybe we'll take some live questions?
Yeah, Justin, you can go to the spreadsheet.
Okay, so here we have a bunch of questions. Thank you all for submitting them, and I'll just kind of walk my way through them. So I've heard that CBD is an appetite suppressant and therefore would aid in weight loss. Please confirm. So yes, it doesn't happen for everyone, and in some people it's considered a negative side effect, but a lot of people that do take enough CBD find that it curbs their appetite. There's also, beyond the appetitive effects of CBD, there are metabolic effects of CBD, and it looks like it could improve someone's metabolic function and also potentially promote weight loss in that way too, even though we have a lot more to learn about that. Next question, can you review how CBD versus CBDA works in autism patients? Recommended protocol for adding CBDA to the mix, when to take CBD away from a protocol? Wow, great question. Pretty complex there. What I find is that both CBD and CBDA are helpful in some of the aspects of autism that have to do with communication and interaction with the environment, as well as anxiety. And so, I usually start with CBD, especially that's what I've had the opportunity to do during my career. Sometimes I see great results. Other times it just seems like we would need to use too much of it to make it cost effective for controlling some of the more severe symptoms. So often I'm using a combination of CBD and THC. If someone doesn't respond well to THC and that has autism spectrum disorder, and I'm not using any THC and the CBD is not that potent, I would use CBDA and try to get a stronger effect with less cost, essentially. And that's a very short answer to a complex question. So, and when to take CBD away from the protocol, I'm doing that most often when it's causing hyperactivity in people with autism. Next question. Is it okay to take CBD isolate in the morning with a microdose of THC, then a little CBD, CBDA full spectrum midday, and then repeat the same morning dose late day and receive the best of all molecules? Or should they take one or the other and not mix them in a given day? So, great question. I'll tell you that probably the only time clinically that I recommend CBD isolate is when people become too sedated from using a regular CBD product. This isn't very often, but as you saw, we have, and most products do have, a significant amount of the terpene myrcene in the CBD product, and myrcene can be sedating. So when people take CBD and it's sedating, it's probably not the CBD, it's probably this other terpene that's in there. And some people are just going to be more sensitive to that than others. So if I'm working with a patient that's taking CBD, they want to use it in the morning, they're getting benefits from it, but it's making them too sleepy, I'll sometimes switch over to a CBD isolate product, and that allows them to get the same benefits but without the sleepiness, although they usually have to crank up the dose a little bit because it's less powerful. So I hope that helps. So another one, my son has been on 30 milligrams daily of Valium for 10 years. He wants to taper, but is extremely fearful of the symptoms he'll have to go through if and when he starts the taper. Has CBD been used, or could it be successfully used to reduce the side effects or symptoms of tapering off Valium? So yes, it could be. I don't want to give advice, and someone that's tapering Valium needs to do so carefully under the supervision of whoever's prescribing it, because if you stop it abruptly, you can get into all sorts of trouble. But if somebody's slowly tapering off Valium, probably the most common thing they're going to experience is anxiety and sleep disturbance. And so CBD could very likely be helpful for that. And there's no drug interaction, so you could start the CBD first and then taper the Valium later. Gonna keep cranking through these. I'm using cannabis oil as medicine. How would the healer CBD affect this? I think we already basically discussed that, and I'm assuming by cannabis oil they're she's talking about a THC product. And so healer CBD may make that THC product a little bit less potent, but maybe more tolerable. And if that's not desirable, I would try the CBDA product instead. Recommendation for someone with high anxiety related to the plant, triggered PTSD perhaps. Okay, so this is probably someone who's very sensitive to THC, and using THC caused anxiety. It does that in some people. People like that can usually very safely use CBD. I think they could use either of our products. They do contain THC, but very small amounts, and very unlikely to be the amount that would trigger someone's anxiety. So I think it's safe. These products would be safe for someone that's very sensitive to THC. Okay, when do you recommend? Okay, so I answered that one already. Is CBDA helpful for seizures and epilepsy? In my experience, it can be, yes. There's one animal study that I mentioned that showed it was 10 times more potent. That's just one seizure model of Dravet syndrome. There's lots of animal models of seizures, and I suspect that CBDA isn't universally helpful, but I would say that it can be helpful. Does CBD reduce cortisol? I have not seen any evidence of that. Cannabis use with THC in it can decrease one's cortisol response to stress, which can be a good thing. So basically, cortisol is made by the adrenal glands as a response to stress, and it's very helpful to us. But if we make too much of it all the time, it can raise blood pressure and raise blood sugar and have these other long-term negative consequences. And so cannabis in general can kind of not turn off, but turn down the magnitude of that cortisol stress response. Does CBD interfere with synthroid medication or lab results? Not that I am aware of. That would be a synthetic thyroid hormone. Is it better to take a CBD oil tincture or a CBD vape? And I think we addressed that. It has to do with, is this a daily condition? Is it episodic and once in a while? And how rapid do you need the results? What is the difference between CBD made from marijuana and CBD made from hemp? Does one have more benefits than the other? So actually, a few years ago, there was more of a distinction there. But what's happened now is that, well, I guess what used to be the case is that the CBD hemp varieties were really more hempy. They had these like really tall, long stalks, and the flowers didn't have a lot of the crystals, the trichomes on it that produce the medicine. But nowadays, when you look at CBD varieties, like the picture I showed you of the farm in Maine, you can see it looks just like the medical or so-called drug type cannabis plants. And so I think now really the main difference would be the THC content. If you went to a cannabis dispensary and bought a CBD product, that product could contain THC that might be 0.5% or 1% or even 2% by weight, whereas a hemp product has to be below 0.3% in the United States. Okay, I would like to know about the CBD used for depression and anxiety in the elderly population. My 79-year-old mother has been depressed for decades. She tried many medications and none helped much. Would CBD help? Is there a drug interaction with the sleep aid? And same protocol to find the right dosage of CBD? Absolutely. I have very little to add for that, except that I've seen it clinically many times, that people with depression that hasn't responded to other treatments, it can respond to CBD. I don't feel like I've ever seen CBD have this super profound effect where they come back and say, wow, my suicidality is just gone. Or, you know, I was severely depressed and I couldn't get anything done and now I'm all over my life. Honestly, I don't see that from CBD. I see incremental improvements where people say, yeah, I'm less stressed, my mood is better, I'm more focused, I'm able to kind of include the things in my day that are important to me. It seems like it's helping more along the lines of function than strictly being an antidepressant. And I think that's a great way to go. Another question. I have been using CBD and it helps me during the day. At night, I take it with THC, but don't sleep. I increase drops and it still doesn't work. I want to get off the opioids that I started last November, but I'm still at 3 to 4 a day. What can I do to get off opioids? Do I think CBDA would work better? So, I mean, what it sounds like is that this is one of the people that CBD is disturbing their sleep. And if you want to get off opioids, you need good sleep. And opioids themselves disturb sleep. So I would start by, if you think CBDA is a problem for sleep, just take it during the day, don't take it at night, and weave some THC into that equation. On healer.com, we have a whole guide about how to use cannabis to help you get off opioids. So I encourage you to refer to that, and I think that'll be very useful and certainly very possible to be successful in that. We have just a few more. My mother has lung issues, early COPD, always has had seasonal allergies and asthma. Would she be a good candidate for CBD or CBDA or cannabis oil? Could this work in conjunction with her albuterol? So yes, CBD and even CBDA, but CBD especially, has been shown to have anti-inflammatory effects directly in the lungs. And CBDA also hits a TRP receptor that's involved in inflammation in the lungs. So I think that both of them theoretically could help. And I have had one really interesting case of a woman who had pulmonary fibrosis, which is scarring of the lungs. And after taking CBD, well, she was doing both. She was doing about 30 milligrams of CBD in the morning and about 10 milligrams of THC at night to help with sleep. And after about 6 months of that, when she went back to the pulmonologist, there was no pulmonary fibrosis, which is not a condition that is expected to ever reverse itself. It's usually a progressive condition, and very rarely would it just go away. And the pulmonologist was quite puzzled by that. And so that was an interesting anecdote. One patient, can't promise that's going to happen any other time. Next question, can CBD help with ADHD? And is the dosage the same that I would recommend? Yeah, I really wouldn't have any different dosing strategy. Again, with cannabis, with hemp, with CBD, people have such different responses. Everyone's their own unique person and has a unique physiologic internal environment. So that's why I like to start with 5 milligrams and work up slowly and really look for the dose that gives the best effect. Okay, and then the last question is, what is the method or process for making CBD and CBDA drops? So basically, we take the CBD material from the farm that I showed you here in Maine, that's organically grown, and we grind it at a very low temperature. So you get this very fine powder. And then when we take ethanol, which is an alcohol that's very safe and that the body can metabolize, so then we extract all of that powder, all the medicinal compounds from that powder into the ethanol. Then there's a couple steps that we use that can remove some of the chlorophyll. Not that chlorophyll is bad, but it does have a strong taste and it gives some people GI upset. So we remove the chlorophyll. And then we take that ethanol and we pass it through our nanofilters, which really cleans it up while maintaining all of that therapeutic range of compounds. So the cannabinoids, the terpenes, and the flavonoids. And by clean it up, what I mean is during the agricultural process, during just the regular farming of it, things in the soil, things in the air, there can be bacteria and mold that even in organically, maybe especially in organically grown cannabis products. And so our process is really removing that. And that's why you saw that it was absent completely in all those lab results. And then after we have this ethanol solution that has all these great cannabis compounds in it, we exchange that into oil. In this case, it's medium chain triglyceride coconut oil, organic. And we chose that because it's not, very few people are allergic to it and it has very little taste. And we move all those good compounds into the oil with just a trace of ethanol remaining, and then we bottle it. That's the whole process. And it's, I think it's very similar to what I found was most successful in the patients here in Maine that were making their own or making small artisanal batches. And this was really one of the drivers. And I see, I see a friend from Maine asking questions and commenting in the chat. And so thank you, Christy, because you and your kind of legacy here in Maine has really inspired a lot of this because, what I was seeing is that these small batch ethanol based extractions were superior to kind of the large scale industrial CBD kind of isolate products. And so when Healer decided to make our own products, what I really wanted to do was capture that artisanal quality at a large scale so that we could bring that to everyone, and so that not everyone has to learn how to do this in their own kitchen, even though I really admire the people that have done that. And I encourage you to continue to do that. Well, I think I've answered all the questions that were submitted previously. We're at an hour and a half now. I'm happy to answer any live questions or hear comments if anyone has feedback. Yep.
Yeah, so I created a second tab on that spreadsheet with some live questions that came through.
Great. Okay. So are we going to let the person ask them live or should I just answer them here?
Just go ahead and answer.
Okay. Okay, great. So does CBD accumulate in fat like THC does? I'm not aware that it's been shown to do that, but I would expect that it does. It has some similar fat solubility. And so I think the question is, you know, there's some evidence that shows that people that use a lot of THC, they can actually store the THC in their body fat. And then when they burn that fat, it gets released into the blood and they could have a temporary THC effect. Is that possible with CBD? Probably yes. What level of THC can be taken without it having to show up in a urine test? I really want to combine my CBD with a very low dose of THC. Well, I mean, that's a complex question, and it really depends on the individual, their body fat percentage, how sensitive the test is, how soon after taking it the test is run. But if somebody's employment is really depending on them having no THC in their urine, then I would not want you taking our healer CBD products, even though there's just a little THC in there. That little bit of THC could give you a positive test on a urine drug screen for THC. And there's certainly ways around that. You know, often if you have a doctor's recommendation saying, I want this person to be taking this product, and they're able to give that letter to the medical officer in their organization, then they wouldn't, then they would probably not have a failed test. They would probably pass it, even though there's traces of THC. But broad spectrum CBD products can cause people to fail THC urine drug screens, as well as additional THC. So please comment on the MRSA studies from Italy. Have others been done since that? So there have been a handful of studies, not just looking at CBD, but also CBG, CBGA, THC, that show these compounds have antibacterial properties. And the question is about a antibiotic-resistant bacteria that can cause skin infections. And so, yeah, there is evidence that these are antibacterial, even against antibiotic-resistant strains. And there's probably going to be some future application for that. There's also some evidence from animals that just taking cannabinoids in combination with antibiotics makes the antibiotics stronger. And a lot of people out there are using cannabis and antibiotics together and may not realize that there can be that synergistic effect. Are there benefits of using CBD over CBDA? Well, I think the main benefit there would be its interaction with the endocannabinoid system. It doesn't look like CBDA is doing much to the endocannabinoid system. It's working in all these other ways with a lot of overlap with CBD, but at higher potency. Okay, the next question. Curious why you choose MCT oil as the carrier. I've been told that hemp extract or coconut oil is the best, and that MCT is not ideal because of the fatty lipids being stripped out, and it does not carry the cannabinoid to the cell as well. So I think I talked about the reasons why I started using it. It might have just been habit. A lot of our patients that we were first using CBD products with had epilepsy. Many were on the ketogenic diet, so MCT oil is very compatible with the ketogenic diet. I like that it is stable. It's liquid at room temperature, so unlike I'm sure a lot of you live in an area where your coconut oil is liquid year round, but it's not like that here in Maine. It's solid almost year round. You get a few days in the summer where it's liquid. So, you know, I think just for convenience, but honestly, I am hoping that we can do a good job of getting these cannabinoids into hemp oil in the future. And even though the taste is a little stronger and some people may not like the taste, that's something that I'm very interested in doing with our future products. But I think in the meanwhile, MCT oil works just fine. We have good results with it. Next question. What about the companies that claim nanotechnology for better bioavailability? Great question. So very few of those companies have actually tested out their claims. There was one company that did so, and I applaud them for that. And they spent the money on doing a pharmacokinetic study in humans and measuring blood levels. What they basically found was that their nanotechnology made their CBD product about 4 times more bioavailable. So people were absorbing 4-fold as much, which sounds really good. But I also showed you tonight that you can do the same thing by taking it with fatty meal. So if you use nanotechnology with a fatty meal, would you get a better result? based on the way that stuff works, maybe a little bit, but probably not that big of a difference. And I don't know, it hasn't been tested. So I think that nanotechnology could be used. We're using nanotechnology to clean up our cannabis. We're not using it to change the delivery method. I think that nanotechnology could be used, but I'd be wary of claims because a lot of people say things and they have zero data to back them up. And then the one company I found that did have data that actually published it, the effect wasn't that profound. Next, not much better than taking it with a fatty meal. Next, or not any better. So the next question is, can I use CBD oil for regulating sugar in the body? I don't think, so if somebody's like diabetic or pre-diabetic, how much would CBD help? I don't know. There's been some human research on that, and it hasn't really shown a big difference either. I believe it was at either 10 or 100 milligrams. Now, a different cannabinoid in the same study, THCV, at the low dose of 5 milligrams twice a day, had a drastic effect. I think it lowered fasting glucose by 12 points over just 4 to 8 weeks. Don't quote me on that, but there is a human study that's looked at both THCV and CBD, and it was THCV that had the really strong signal as being a good kind of anti-diabetic cannabinoid. Parkinson's disease benefits. Great question. So Parkinson's disease can be tricky to treat for anyone, even a cannabis clinician. Very often when I treat Parkinson's, I'm seeing improvements in all the other kind of quality of life aspects before I see improvements with the Parkinson's. So the mood and the focus improves, the sleep improves. There's often pain. People with Parkinson's sometimes have pain. That can improve. But when it really comes down to the movement, say the tremor or the bradykinesia, which is the trouble walking, moving around, I see less often do I see good results. And when I do, it's usually after a period of consistent use. So it's not one of those things where they take CBD and a week later they're calling you and saying, wow, this is amazing, like we do get with some conditions. Parkinson's can be a little trickier, and for people that aren't responding, my advice would be to stick with it and see if you get better results over time. And then the last question, do you use CBD for people with fibromyalgia? Yes, I do. I think CBD is great for people with fibromyalgia. It's addressing the symptoms. It's addressing the underlying inflammation. It's very safe, very few adverse effects. I think it's a great treatment for that patient population. Thank you for asking that. All right, I got through all the rest of the questions. And I'm willing to do more. If somebody's got anything that's really exciting to ask about, please go for it. Oh, I see one at the bottom that I'll just take. What is the best way to consume raw hemp flower? Not the broadleaves, but the actual CBDA-rich flower, and at what dose? Well, I would say, what season are you in? Because if you can go out to your backyard and pick those little CBDA flowers off there, just pop them in your mouth and eat them up. And I don't think the dose matters. So like a lot of things that we study as medicines that come from the plant kingdom, I believe that there's probably an appropriate rhythm to that. So like people are really interested in polyphenols, things that come from like blueberries, for example. And there's probably more benefit to getting a lot of those all in one season than taking a little bit year round. And so I think we could probably relate to cannabis in a similar way, where there's times of the year where you get more of it and times where you get little. But as far as eating raw CBDA flowers, I say go for it. Throw it in your smoothie, pop it in your mouth. If you're looking for CBDA, you can also make a tea. That's a great way to take it. You could mix it with your other hot beverage or just make a pure cannabis tea. The CBDA is quite water soluble, so it'll get into the tea water and you can drink it that way. I see, gosh, the chat is moving fast, but I'm like just picking them off here. Would you suggest trying CBDA if I experienced extreme fatigue with CBD? I would recommend trying that, and you could, try a very small sample size of that. I'd be curious. It's a good experiment because then you could decipher, is it the CBD that you're sensitive to, or is it more of the myrcene that's in the CBD formula that's causing that effect? Wow, we got a lot going on here. Is there a CBD form that helps with eczema? I think topically applied CBD, probably the stronger the better, would be something to try for eczema. A lot of people report benefit with the itch, and then some people with the actual, the lesion itself getting smaller or less red and less inflamed. The CBD also has the anti-scarring effects, and so it could potentially help prevent the scarring that's left after the eczema. What hybrid is the best option for CBD and THC extraction? Maybe I don't fully understand that question, but I think that they can basically be extracted in similar ways. They have similar physical properties. How does CBD affect blood pressure? It can potentially lower it just slightly, but that does bring up a really good point that I did not mention in this webinar. There is evidence that CBD, while it can lower blood pressure slightly, it can raise the intraocular pressure, which is the pressure in the eyes. And so a lot of people think about cannabis being good for glaucoma, and it certainly can be, but CBD has been shown to slightly raise eye pressure and to decrease the effect of THC, which lowers eye pressure. So if you really have high pressure in the eyes and you want to treat that with cannabis, I would encourage leaning more on the THC side and not the CBD side. Now, something else that's interesting is that glaucoma is not just about pressure. A lot of people kind of mistake it for that, but actually with glaucoma, there's a deterioration that occurs in the retina and the optic nerve. And a whole different line of research looking at cannabinoids, not just for the pressure of the eye, but for that neuroprotective aspect, shows that both THC and CBD can be helpful. So I wouldn't say you need to completely eliminate CBD. I think a little bit of that's okay. If CBD was really helping you with something else and you had glaucoma, just go back to your eye doctor and have your pressures measured and make sure that CBD isn't elevating your eye pressure. Well, we have a lot going on the chat, but I'm thinking we should probably wrap it up pretty soon, even though I said I'd stick around and answer all your questions. What I want to do first is just flip through and see all your beautiful faces, because there's so many people on tonight, and I appreciate you turning on your cameras. And yeah, it's just really rewarding for me to see you all. Thank you. What an amazing community we have. Well, I'm still going. I had a long day in the clinic today. I love the work I do. I love that you're all still tuned in, an hour and 40 minutes later. So maybe we can have even a little more interaction. And if there's a live question that someone wants to ask, or if there's a story that's brief about using CBD that you want to share and you think would be useful for the community, you can say that on the chat, and I'm happy to entertain those as well. And in the meanwhile, I'll look through just a few things here. Okay, so there is one question that kind of grabbed my attention. Can you speak to using choline, just like CBD, to help mitigate the effects of THC? Sure, don't think it's really happening. So what happens there? This was kind of popularized by Rick Simpson, who has popularized a lot of things in a great way, but I don't think that it's that real. There's something called citicoline, which is not choline. It's different. It's kind of a fatty substance that gets into the CNS, and it has central nervous system, and it has some neuroprotective effects in animal models, and it's good stuff, probably for brain injury and brain inflammation. There's no evidence that it mitigates the side effects of THC. I've heard a lot of people say that it does. I've tried it myself, and I haven't found it to do that. If it works for you, great, but I don't know that's really effective. I think CBD would be much more effective for that. And then, so citicoline is different than acetylcholine and different than choline itself, which is found in foods. Interestingly, cannabis roots are a good source of choline, but lots of other foods are as well, including organ meats. Okay, a little bit of a tangent there. And it looks like, okay, so we have someone that's got their hand up that wants to ask a question. Let's do it.
Yeah, Sue has her hand raised, and go ahead, Sue.
Hear me now?
Yes, we can hear you.
Hi. 2 questions. Sorry.
No problem.
One is, how can I get help with MS? And what about reoccurring polio?
Wow. Okay. So, I think that often with MS and reoccurring polio, there's quite a bit of spasticity. And I think to rely only on CBD for treating that spasticity, you may not get the full benefits that you're hoping for. There's a huge amount of data on combined THC and CBD for treating MS, and it's not just that that's what's been researched. I mean, clinically, that's what looks effective from my perspective as well. So if that's what you're dealing with, then I would certainly use CBD. You could see how far you could get with it, but don't give up on cannabis until you try a combination of CBD and THC.
Thank you. THC has never been good for me. I have a lot of bad reactions to it. I don't like the way it makes me feel either.
Okay. Well then, yeah, so you might be one of these people. It's probably like 1 or 2% of my practice that's just super sensitive to THC and doesn't tolerate it. And if you are one of those people, then the tiny amount of the tiny amount of THC that's present in our CBD product might be just enough to give you that nudge without getting into the side effect zone. And you may be able to add just like another 0.5 milligram or another 1 milligram. So very careful THC dosing below that threshold of side effects may also be helpful for your symptoms.
Okay, well, thank you. I'm going to be ordering.
Thank you. And let us know how it works. I'm always very happy to learn from all of your experiences.
All right, Jason has his hand raised.
Jason, where are you?
Cleveland, Ohio.
There we go. All right.
My question to you is, okay, so I got a kind of a remarkable story. I was given 2 years to live, and this past September 27th, 16 years from a rare form of brain cancer. I don't believe there's one magic bullet out there, but I do believe that cannabis is a huge part of my longevity. So prior to the stem cell transplant I just had a year ago, April 24th, my tolerance was off the charts. And post-transplant, I have almost no tolerance, and I get very irritable when I take CBD and THC, either one. It's almost like I got a different personality. Have you heard that in the past, or probably not many people you do with?
I haven't heard that, but I'm super curious about it. Whose stem cells were they? Your own or someone else's?
My own.
Wow. And the stem cell was intrathecal? It was ejected into the CNS, or where was that done?
It was a full stem cell transplant, autologous stem cell transplant. I'm also in Kettering.
Got it. Wow.
And they wipe my whole immune system out. I'm like a newborn. I gotta get all my new vaccinations again.
There are a lot of changes going on inside your body, and I'm sorry that you're so sensitive to cannabis now. I'm not sure how I would approach that. I mean, that's something for me to scratch my head and think about. And if I come up with anything, I would let you know. But thank you for sharing that, Jason. Something changed in your physiology that makes you extremely sensitive. I guess my first thought would be, with very low doses, is there a therapeutic window? Like, can you feel some benefit before you get to that threshold of side effects?
So I've been titrating, and it seems like the lower the dose I get, the higher the effects are, the worse they are. It's bizarre. It's
bizarre, but that's not entirely unexpected. Cannabis does work like that sometimes. So I have this is really out there, okay, and I'm not necessarily recommending it, but I'll tell you, I've had a couple patients that have had experiences not like yours, but where they've overdosed with cannabis and then subsequently had this strange sensitivity that they never had before. And one approach to that would be a homeopathic treatment. So there's 2 cannabis homeopathic remedies. This is probably where these terms actually came from. A lot of people don't know, but there's a cannabis indica and a cannabis sativa. Homeopathics are extraordinarily dilute, and it's more of just the energetic quality of the original compound that you're taking. You're not really taking the molecular aspect of it. And so there might be a way to kind of reset your system's sensitivity to cannabis by taking one of these cannabis homeopathic remedies. And it's something that I would encourage you to talk to a homeopath about. That might be one way to change your sensitivity by affecting kind of the energy system of your body. And I've seen that work clinically a couple times.
Will there be a replay of this or no?
I believe so. Simone, what are we going to do with this video?
Yeah, we have recorded it and we will make that available. Just keep an eye on
Outstanding.
your email. Yeah.
Thank you very much. And Dustin Sulak, you are a rock star. I appreciate all you do.
Thank you for sharing your story and congrats on being alive. That's amazing. Okay. Who else do we got here?
Trina is next.
Hey, Dustin, thanks for doing an amazing lecture as always. I'm a
You're welcome.
veterinarian and I practice cannabis medicine as well, which is a ton of fun on animals. I don't speak back, right? But one of the things I've started to notice is when there are products that have acids, specifically higher amounts of CBDA, I actually think it may cause worsening of the anxiety. What have you noticed in your patients on products that have higher levels of the acids, and specifically CBDA and a little bit of THCA, when they go on these products in hopes to help with anxiety? And I find sometimes it makes it worse versus some of these other broad spectrum products that are just, say, 30-to-1 CBD with very little acids at all.
Yeah, great question. So what I would say is the people that are sensitive to that effect of CBD, which, normally when people tell me about it, they're not saying it made me more anxious. They're saying it made me hyper or restless. And I think, there's probably a distinction there that's harder to get from the animals, but it sure could make people anxious. I just don't see that as much. And I do see that the CBDA does that more strongly than the CBD. So it does a lot of things more strongly. So yeah, I guess I'm really thankful for your input because I hadn't heard that from a veterinarian before, and that's important. But yeah, I think that for those that respond poorly to CBDA might make them respond even more poorly because it can be stronger.
Or we just we use a totally different product that doesn't have any acids and they tend to do better. And some of these patients are doing well on isolates, which is awfully odd because I don't normally recommend them. But then they'll say, oh, I bought something and I look at the COA and it literally is an isolate. And then they say their dog's doing great. And I'm like, we have so much more to learn.
We do.
Yeah.
There's just so many compounds and they're complex. So again, like, is it that the formulas that you're seeing that contain CBDA, do they have more terpenes of something that can be complicating this picture? Usually yes, because if they're CBDA, they haven't been exposed to heat and there's going to be a lot more stuff in there. So yes, we have a lot to learn. I'm glad for you to share that. Can you tell us something about a success story with an animal in CBD?
Yeah, no, absolutely. So I'm an oncologist, so I treat a lot of cancer with cannabis, and many of them are on traditional therapies, and some are just on cannabis and maybe a targeted therapy, or I do traditional Chinese herbal medicine. So I have one case that I'll always remember. You always remember those one or two cases that really got you into cannabis. And so I had this little 10-year-old Jack Russell Terrier that presented with 3 different cancers. And they started a targeted therapy. After 6 months, we had progressive disease of 2 out of the 3 cancers. So they said, we don't want to do chemo, we don't want to do radiation, what else can we do? And I said, well, this was a few years ago. I said, let's start cannabis and see what happens. And we did a 1-to-1, and it was literally 1 milligram of CBD and 1 milligram of THC. It was a 5 mg per ml type formula. I don't even remember at that time if there was terpenes or not in there. And within about a few weeks, the owner said the tumor is starting to go down. And at this point, this poor dog, it was a squamous cell carcinoma of the jaw. It had taken up half his face and he couldn't see out of his right eye. And so let's give it a shot. So after a few weeks, he started to say the tumor was getting smaller. He came to me after 3 months and I couldn't find the tumor in the dog's mouth. The only thing I did was add in this 1-to-1 with a targeted therapy. And so I started to say, well, let's just add in cannabis to all this targeted therapies. And there's I have another metastatic salivary squamous cell carcinoma that also was supposed to have a few months to live, came in, was really sick, pulmonary met. It's been 2.5 years, and he's currently on 30 milligrams of THC BID at an 18 kilogram dog. And he's on maybe like 10 milligrams or less, probably 5 milligrams of CBD twice a day. I mean, he's in remission, doing phenomenal. So I have there is something to it, right? And seizure patients, phantom limb cats and dogs that have amputations from bone tumors, that nothing is working. They're like zonked on opiates and fentanyl patches. And then I just give them, sometimes it's just like a 4-to-1 CBD to THC, and they'll say, oh, they've come out of their, you know, behind the bed and now they're ready to eat and they're feeling a lot better. And I wonder if it's just changing that perception of pain more so, you know, than actually reducing inflammation. I don't know, but it's pretty amazing. It's certainly something that I've started to do and I love and I'm passionate about, and I'm ready to help a lot of animals.
Wow.
Thank you for everything you teach, because I certainly use it in animals all the time as well.
You're welcome, Trina. I'm so glad to hear that. What state are you in?
California.
And is it totally legal for all these animals to take their medicine?
I mean, it is, I guess, and that we have dispensaries, right? And so they can walk into a recreational dispensary and buy certain products. But I think a lot of people are just going online and buying hemp products, and I'm trying to teach and educate as much as possible on the safety and looking at COAs and not just buying anything and not going into the dispensaries and listening to bud tenders that are guiding them to unsafe products. So a lot of what we are trying to do, we're starting a nonprofit called Veterinary Cannabis Society, and that is to help really give veterinarians a voice and pet parents a voice and industry leaders a voice in the veterinary cannabis field. So I will tell you more about it as time goes on, but it's super exciting.
Please do. It's very exciting for me to hear about your results in your field. Thank you for sharing.
All right, Donna is next.
Yes, I have been taking CBD on and off, and I've had a lot of problems with it upsetting my stomach. I have a lot of gastritis and stomach issues. And I heard someone, or I saw someone posted something about suppositories. I didn't know that there were. Would that be an alternative solution? Because it wouldn't go through the stomach.
That's right. Yeah, that would be an alternative route to try. So the little research that's been done on cannabis suppositories shows that, at least for THC to get absorbed, it actually depends quite a bit on the formulation of the suppository. And again, there's just a tiny bit of research, but I think certainly safe enough to try. And yeah, if you were able to absorb it through the rectum, then it wouldn't affect the gut directly. It would go more into the bloodstream. So I don't have a lot of experience with that with my patients, but I'm very curious if you try it and find that it's helpful.
Where do you get them?
Yeah, so you would make them probably. And
okay, out of the CBD itself.
So yeah, there's recipes that you can find. You can make a little mold yourself out of like aluminum foil or something like that, or you can buy suppository molds. And I think I see that Eduardo is on, and I know that so we have a pharmacist on that maybe share. Maybe, I don't know, Eduardo, do you want to share like a simple suppository recipe? Simone, can you unmute Eduardo?
Hi, Dustin. How are you?
Thank you. I'm great.
Yeah, actually, I tried the suppositories myself. I just melt cocoa butter with oil. I didn't use your CBD yet for suppositories, but I used to extract cannabis oil with sesame oil, and I just mix it, and I use the technique that you mentioned with the tin foil, the foil paper. And it worked. For me, it worked. It was great. And it's really easy. You have to put those in the fridge, and that's it. You're ready.
So you would use the oil that you have?
Yes, the oil that you have, and just melt it with cocoa butter. And then put that on the freezer.
Would that be diluting it?
Yes.
Okay.
Yeah, but if you think about the size of a suppository, those are probably like a couple milliliters. So if you didn't dilute it, you'd be taking 100 milligrams.
Okay.
You have to calculate. Yeah, she has to calculate her dosage with the oil, and then add the cocoa butter to the volume.
How would you do that?
Yes, you can warm a little bit the cocoa butter. It really melts at normal temperature, like what is that in Fahrenheit? Like 97, 100 Fahrenheit. Yeah. It will melt.
So you could just heat up the cocoa butter a little bit, like the amount that would fill, say you wanted to fill 5 suppository molds, or even just 2, right? So you would just use the amount that would fill a couple suppository molds, heat that up until it's liquid, add, you know, double the amount of CBD that you would want, you know, to take in a
For a
single
dose.
dose,
Mhm.
since you were making 2 of them. And then you just kind of put it in the mold when it's liquid, put it in the fridge, it cools off. And then when you take it out of the fridge, it would be solid and you could insert that.
The refrigerator, not the freezer.
I use the freezer.
Freezer, okay.
Yes.
Because I was taking sublingually 25 milliliters. Is it 0.25 milliliters? You know, it's a dropper. And that's the amount I was taking, and that was upsetting my stomach. So, and that's not even a lot.
Yeah, sounds like you're sensitive. So, and I see another question in the chat. Could you use a capsule as a suppository?
Oh,
So
that's
I
an
mean,
idea.
no
That's
harm
easier.
in trying that, but it's probably that some of the oil, the fatty substance from the cocoa butter would probably help absorption. But you know, it's
You can use coconut oil. Can you?
you could use coconut oil or cocoa
Oh,
butter.
okay.
I think the cocoa butter
I
might
think
have a little
coconut
better.
yeah, because it's going to solidify, and coconut oil is not going to work like that.
Okay. I've never heard of coconut butter.
Oh, it's cocoa
No,
butter.
cocoa butter.
Cocoa butter.
Cocoa.
Okay.
Mhm.
Yeah.
You can buy it at Amazon.
Okay.
Yep.
Thank you
Smells
very
great.
much. Thank
You're
you.
welcome. Oh, and then another question that just came across the chat is it could it be the MCT oil that's upsetting your stomach, Donna, instead of the actual cannabinoids? And that might be something, you know, to try a product that doesn't contain MCT oil. Oh, and you're muted, but just another thing to think about. Okay, do we have anything else? It's been 2 hours. We might wrap it up here, but I could keep going if we need to.
There's a few more questions. I'm not sure how you're feeling.
Yeah, let's do it.
All right, Estefania. Go ahead.
Okay. Hello, Dr. Sulak, and hello, everyone. I'm Estefania. I'm talking from Peru, and I wanted to share that I'm a physician and I treat with cannabis, and it's really awesome when you see a person, for example, a kid with epilepsy, and you read the studies and it says like 200 milligrams a day or from 200 to 600. And then you see Dustin Sulak's presentations who said that he uses from 0.0015. And it's true. And I want to share this because sometimes we get anxious with the dose and we want to go up. And sometimes we need to go down. And I have a child that uses 1 drop a day and he has no more
Seizures.
Seizures, and that's awesome because I never tried to go up at first, I think, but then I listened again to your presentation and I said, okay, let's wait, and then it happened. It worked.
Wow.
And sometimes also a little share is that I have a patient with carotid glomus, you know, like a tumor in the carotid.
Yeah.
And she has a lot of pain and no anti-inflammatory can work with her. And I said, okay, let's try cannabis. I have no literature, but it's not gonna be bad anyway. So it surprisingly worked for her pain. And that's something that can maybe encourage someone who knows someone with that.
And
Thank you.
yeah, thank you for sharing that. This low dosage range is something that surprises me still, even though I've been teaching about my findings and you've been exposed to that. It's still so surprising. So I can imagine you're surprised also. You bring up a good point though, and I want to just make this clear that the dosing that we talked about tonight with CBD does not necessarily apply to people with seizure disorders. If you have a seizure disorder, please use CBD under the supervision of a clinician that knows what they're doing. And hopefully, like Estefania, she's been, your clinician's been exposed to the idea that there can be responses in this very low dose range, and that's an area worth exploring. But don't just use the healer usage guide. Use a professional. Well, thank you so much for joining from Peru. I love the international audience and that you're here with us. Thank you. All right, what's next?
All right, Diana is next.
Okay.
Hi, doctor. I'm a college student from Peru too. Thank you for your valuable information. I'm currently doing some research from college, and my question was if there is a cannabis hybrid, which is the best option for the extraction CBD and THC, just for therapeutic use.
So the question is, what's the best extraction?
Which is the best hybrid, the cannabis hybrid?
It's a complex answer that doesn't really fit the question. So I guess let's start. I mean, gosh, that's a really big question, Diana. So
yeah, I know there are a lot of hybrids that.
Yeah, I mean, I think traditionally this idea that cannabis is like three things is just really not accurate. Is it sativa, is it indica, or is it a hybrid? Even starting there, if we use those terms and kind of chase around the right sativa or the right indica or the right hybrid, it's probably going to lead us on a what we call the wild goose chase, which means we don't really get the answer. I think that how to summarize, there's a lot of individual differences. I think usually in the clinic, I'll try a few things. Like today, I had someone that had anxiety that I was recommending inhaled cannabis to. And instead of telling her buy indica, buy sativa, or buy hybrid, and even instead of telling her, here's the variety of cannabis that I want you to get, go get blueberry, or go get headband, or go get this one or that one. What I told her to do was go to the cannabis store and ask the person who works there, among your patients with anxiety, what sells the best? Buy a very small portion of the 3 top sellers, take them home and try them, and see what works best for you. And then make sure that you check out and really remember the aroma of the one that works best for you, because when you're shopping for cannabis in the future, something with a similar aroma may have a similar therapeutic effect. And that's so that's a lot of instructions for someone and a lot of steps, and that's still kind of like guesswork. So there's just so much to getting the right variety. What I would say is that the variety of cannabis is most important when someone's inhaling it. And when someone's using it by mouth in an oil or a tincture, what I often prefer is not a single variety, but a mix of varieties. And that's because we know that there are trace constituents that are certain types of plants have and the others don't. And I want as broad of a spectrum of those as possible. So with our CBD products, for example, there were, I believe, 4 different hemp varieties that all had very similar results when we analyzed them. They looked a little bit different when they were growing. The lab results were slightly different, but very similar. But we mixed those all together because we know there's components that we're not testing for that are probably in there that are distinctions among these different varieties, and that it's nice to kind of get that as broad of a constituent profile as possible. So I hope that answers the question. I'm a big fan of mixing varieties when it comes to the oral formulations.
Yeah, thank you so much. Really appreciate it.
You're welcome.
Okay, and then Jane is the last question we have. Sorry, it's a little. Okay.
Jane, are you with us?
Yeah, I'm unable to open her microphone.
Oh no. Sorry, Jane. And if there is anyone else that wants to fill in and ask their own question for Jane, I do see, looks like Stanley's waving at me. If we can unmute Stanley while we're working on it for Jane, maybe we'll end on a real question.
Yes,
Hi. Hi, can you hear me?
Yeah, absolutely.
I just wanted to ask real quick, and I don't know if you can answer this question, but in terms of dry herb vaporizers, there's been a lot of controversies about these vape pens, you know, whether it be the vitamin E acetate. Recently, it was shown that perhaps the coil could be toxic. Dry herb vaporizers are different because, you know, they're not these pre-made ones, but at the same time, how do you determine, you know, what a safe dry herb vaporizer is, like a portable one, or do you have a method? Or
Yeah, great question. It's a great question. So dry herb vaporizers, for those that don't know what we're talking about, it's kind of like a little convection oven that will heat the cannabis flower up to a temperature where you can inhale the medicine, but it doesn't actually burn the plant material. So when you're done, instead of like a pipe where you see ashes and everything's burned and you've kind of inhaled all those products of combustion, the dry herb vaporizer, what's left behind is just kind of a brown toasted looking plant material. So yeah, to answer your question, Stanley, I can't be completely sure, but I like the ones that don't have any plastic in between the cannabis and my lips. You know, I think that's important. And so like Airizer is a brand that makes a couple models that I like, one a very small one called the Argo and a bigger one called the Solo 2, where really the air is getting heated up somewhere in the device. And theoretically that's in a ceramic heater. And then it's passing into a glass tube, and then it passes through the cannabis, which is inside the glass tube, and you put your lips on the glass. And so I like that. You know, I don't like it when you can't see the heating element, when you can't see what's really inside and you don't know what that pathway is. But regardless of the brand, what I like to do is first time you use it, crank that thing up to the hottest setting, let it sit there for 5 or 10 minutes on the hottest setting, and periodically blow through it. Don't suck through it, but blow through it. And you know, almost invariably, you'll be able to smell some off-gassing. I don't know if it's glue in there or some of the plastics or whatever, but I don't want people inhaling that on their first use of their brand new vaporizer, and they're trying to get some nice smelling cannabis flower, and instead they're getting toxic fumes. So I don't know, does that answer the question?
It does. Thank you so much.
You know what? The other one, Stanley, that I wanted to point out is the old-fashioned vaporizer model, what they call like the whip. So there's like a glass part here, a silicone tube, and then another glass part, and you basically put the cannabis in one end and you hold it up to a heating element. You totally see what you're getting that way. You know, so some examples would be like the Silver Surfer or the Buddha, or an old-fashioned little wooden box one called the Easy Vape or the Vape Brothers. I love those. They're inexpensive. They're certainly not portable and sleek, but they work really well.
Okay, thank you.
You're welcome. And I see that Tamara mentioned Da Vinci is a nice one, and I agree that is a nice one as well. Well, that is probably a good note to end on. As you can tell, I get very excited by this, and so I could keep going, but we're going to have another healer webinar that's not just about CBD, but that includes the research updates and the questions and answers. And I believe that's a week from Wednesday. So please tune into that. I mean, I see that 170 people stayed on for 2.25 hours, which I think is amazing. And what I would say is, if you're one of the people that stayed on this long, and that means you're really interested in learning about cannabis, and you may appreciate the training curriculum that we have on healer.com. It's not free, it's paid, but it's a low fee that really includes a lot. We have 3 whole curricula that you can take online and at your own pace. And then we have all the webinars from the last 2 years or more pre-recorded and timestamped, so you can get to the question and answers that are interesting to you. It's just a lot of material and a great community that talks to each other in the forums and stuff. So yeah, please consider joining our community if you're one of the folks that is left with us 2.25 hours later. I sincerely love the opportunity to talk to you all tonight, and yeah, thank you. This just makes my night. I hope this was helpful for you all, and if you do try the Healer products and you enjoy them, please let us know. If you try them and they don't work for you, I want to know that as well. So I really appreciate your feedback, and have a great night.